Hello everyone, welcome back to the SMA Victor, where we delve into important topics related to spinal muscular atrophy and work to spread awareness about this condition. Today we're going to discuss the authorized disease-modifying treatments for SMA. These treatments have been game changers in the lives of those affected by SMA, so let's dive right into the details. What are disease-modifying treatments? Disease-modifying treatments are therapies that go beyond just managing symptoms. They target the underlying cause of a disease to slow its progression or improve its course. For spinal muscular atrophy, these treatments aim to increase the level of the SMN protein, which is crucial for motor neuron survival and function. In SMA, the lack of SMN protein due to mutations in the SM1 gene leads to the degradation of motor neurons. Disease-modifying treatments work to boost SMN protein levels, helping to protect these neurons and improve muscle functions. Spinraza, Nusinersen. First up, let's talk about Spinraza, also known as Nusinersen. Spinraza was the first FDA-approved treatment for SMN and has been a breakthrough for the SMA community. It's an antisense oligonucleotide, which means it works at the RNA level to increase the production of the full-length SMN protein from SMN2 gene. Spinraza is administered directly into the cerebrospinal fluid through a procedure called a lumbar puncture. The initial treatment involves 4 loading doses, followed by maintenance dose every 4 months. Clinical trials have shown that Spinraza can significantly improve motor function and slow the progression of SMA, particularly when started early. Spinraza has been life-changing for many individuals with SMA, enabling them to achieve milestones they might have not reached otherwise. However, it does require ongoing administration and regular medical follow-ups. An SMA gene abaparovic. Now, we have Zolgensma, a gene therapy that targets the root cause of SMA by delivering a functional copy of the SMN1 gene. Unlike Spinraza, which requires ongoing treatment, Zolgensma is a one-time infusion that works to replace the faulty SMN1 gene with a healthy one. Zolgensma is administered intravenously, and once inside the body, it delivers the new gene to the motor neurons, enabling them to produce the SMN protein. This treatment is particularly effective when given early, ideally before symptoms appear, as it can prevent the severe progression of the disease. Zolgensma has shown remarkable results, with many children achieving developmental milestones like sitting, standing, or even walking. However, because it is a newer treatment, long-term outcomes are still being studied. Evrysdi, Risdiplam. Last but not least, we have Evrysdi, also known as Risdiplam. Evrysdi is a first oral treatment of SMA, making it a more convenient option for many patients. Like Spinraza, Evrysdi works by modifying the splicing of the SMN2 gene to increase the production of the full-length SMN protein. Evrysdi is taken once daily as a liquid, which can be easily administered at home. This makes it an attractive option for individuals and families who prefer a non-invasive treatment. Clinical trials have demonstrated that Evrysdi improves motor functions across different types of SMA, including type 1, 2, and 3. The flexibility and efficacy of Evrysdi have made it a popular choice, particularly for those who may find frequent hospitalization challenging. It's important to note that, like the other treatments, Evrysdi is most effective when started early. The importance of early diagnosis and treatment. One common theme across all these treatments is the importance of early diagnosis and intervention. The earlier SMA is diagnosed, the sooner treatment can begin, which can significantly improve outcomes. Newborn screening programs are helping to identify SMA earlier, allowing families to start treatment before symptoms become severe. Each of these treatments has its own strengths, and the choice of therapy often depends on various factors like the type of SMA, the patient's age, and specific needs. It's crucial to work with a medical team to determine the best course of action. Thank you all for joining me today to explore the authorized disease-modifying treatments for spinal muscular atrophy. These treatments have brought hope and improved quality of life for many individuals living with SMA. That's all for today, folks. Subscribe to our channel and check the links within the description to learn more about SMA.